Ever wondered why the flu hits so hard and fast? Well, it's all about the nature of this sneaky little virus. It slips into your body, uninvited, and begins to multiply rapidly, turning your cells into miniature virus factories. Before you even know it, you're feeling the full force of its invasion. Fever, chills, body aches, and fatigue. It's a fast-paced, high-stakes takeover with the flu virus as the cunning culprit. But don't fret. This is where Tamiflu comes into the picture. Imagine the flu virus as an invading army and Tamiflu as your body's secret weapon. The flu, much like any other army, has a tactical strategy. It enters your body, takes over your cells, and uses them as factories to produce more of its soldiers. These newly created viruses then leave the cell to invade more cells, and the cycle continues, causing you to feel sick. Now let's introduce Tamiflu into this battle scenario. Tamiflu is like a spy infiltrating the enemy lines. Its mission? To sabotage the enemy's operations. But how does it do this? Tamiflu works by inhibiting a specific enzyme called neuraminidase. Think of neuraminidase as the flu virus's getaway car. After the virus has taken over a cell and created more viruses, neuraminidase allows these new viruses to escape the cell and continue the invasion. Tamiflu, however, interferes with this escape plan. By inhibiting neuraminidase, Tamiflu prevents the new viruses from leaving the cell. Now you might be asking, what happens to these trapped viruses? Well, they're like prisoners in a cell. Over time, your body's immune system, the police force in this analogy, comes along and destroys these trapped viruses. This means that the flu virus is unable to continue its invasion and you start to feel better. It's important to note that Tamiflu isn't a cure for the flu. It doesn't kill the virus directly, but rather slows down its spread, giving your body a better chance to fight back. The earlier you take Tamiflu after the onset of flu symptoms, the more effective it can be. So essentially, Tamiflu stops the flu virus in its tracks, preventing it from wreaking more havoc in your body. But how effective is Tamiflu really? Tamiflu is renowned for its effectiveness against the flu, but let's dive a bit deeper into the specifics. Numerous studies have shown that when taken within 48 hours of symptom onset, Tamiflu can decrease the duration of the flu by as much as 1 to 2 days. That's right. You could be back on your feet and sipping your morning coffee in no time. But the benefits don't stop there. Tamiflu also has the potential to reduce the risk of complications associated with the flu. This includes serious health threats like pneumonia, which can be a real game changer for those with compromised immune systems or chronic health conditions. So it's not just about getting over the flu faster. It's about preventing the situation from escalating and keeping your health in check. Remember, Tamiflu is most effective when taken early. Like any medication, Tamiflu isn't without its potential side effects. When it comes to the most common ones, individuals may experience nausea, vomiting, or an upset stomach. These are usually mild and temporary, but if they persist or worsen, it's important to contact your healthcare provider. However, Tamiflu can also cause some more serious side effects, though these are relatively rare. These may include hallucinations, erratic behavior, or even severe skin reactions. If you notice anything unusual or alarming while taking Tamiflu, it's crucial to seek medical help immediately. Now, it's important to remember that just because a side effect is possible, that doesn't mean it will happen. Everyone's body responds differently to medications. But being aware of these potential side effects allows you to monitor your health more closely while taking Tamiflu. And this brings us to some key counseling points. It is essential to communicate with your healthcare provider before starting Tamiflu. Discuss your health history, any other medications you're taking, and any concerns you might have. Your provider can then tailor their advice to your specific situation, helping you make the best decision for your health. It's also worth noting that Tamiflu is most effective when started within 2 days of feeling flu symptoms. So, if you're feeling unwell and suspect it might be the flu, don't wait. Reach out to your healthcare provider right away. Armed with knowledge, you can make an informed decision about whether Tamiflu is right for you or your loved ones when the flu strikes.